Question 1. A nurse is prioritizing care for 4 patients in the emergency department. Which patient should the nurse assess first? A. A patient with a sprained ankle reporting moderate pain. B. A patient with chest pain and diaphoresis. C. A patient with a fever and productive cough. D. A patient with a laceration on the arm that is not bleeding. Answer. B. A patient with chest pain and diaphoresis. Question 2. A nurse is delegating tasks to a licensed practical nurse, LPN. Which task is appropriate to delegate? A. Developing a care plan for a newly admitted patient. B. Administering oral medications to a stable patient. C. Performing an initial assessment on a patient with chest pain. D. Evaluating the effectiveness of a patient's pain management plan. Answer. B. Administering oral medications to a stable patient. Question 3. A nurse is assigning tasks to unlicensed assistive personnel, UAP. Which task can be safely assigned? A. Monitoring a patient's blood glucose levels. B. Assisting a patient with ambulation to the bathroom. C. Administering a subcutaneous injection. D. Teaching a patient about insulin administration. Answer. B. Assisting a patient with ambulation to the bathroom. Question 4. A patient with heart failure is experiencing dyspnea and has a respiratory rate of 28 breaths per minute. What is the nurse's priority action? A. Administering a bronchodilator as prescribed. B. Placing the patient in a high Fowler's position. C. Encouraging the patient to perform deep breathing exercises. D. Administering a diuretic as prescribed. Answer. B. Placing the patient in a high Fowler's position. Question 5. A nurse is caring for a patient who is postoperative day 1 after abdominal surgery. Which finding requires immediate intervention? A. Serosanguinous drainage on the dressing. B. A temperature of 99.2 degrees Fahrenheit 37.3 degrees Celsius. C. Absent bowel sounds. D. Sudden onset of severe abdominal pain. Answer. D. Sudden onset of severe abdominal pain. Question 6. A nurse is triaging patients after a mass casualty event. Which patient should be prioritized for immediate treatment? A. A patient with a fractured arm and stable vital signs. B. A patient with an open chest wound and respiratory distress. C. A patient with minor burns on the hands. D. A patient with a head laceration and no neurological deficits. Answer. B. A patient with an open chest wound and respiratory distress. Question 7. A nurse is delegating tasks to a certified nursing assistant, CNA. Which task is appropriate to delegate? A. Taking a patient's vital signs. B. Inserting a urinary catheter. C. Administering an intravenous medication. D. Assessing a patient's wound healing progress. Answer. A. Taking a patient's vital signs. Question 8. A patient with diabetes mellitus reports feeling shaky and sweaty. What is the nurse's priority action? A. Administering insulin as prescribed. B. Checking the patient's blood glucose level. C. Offering the patient a high-protein snack. D. Encouraging the patient to rest. Answer. B. Checking the patient's blood glucose level. Question 9. A nurse is caring for a patient with a suspected myocardial infarction. Which intervention should the nurse prioritize? A. Administering oxygen via nasal cannula. B. Teaching the patient about lifestyle changes. C. Preparing the patient for a stress test. D. Encouraging the patient to ambulate. Answer. A. Administering oxygen via nasal cannula. Question 10. A nurse is assigning tasks to a team. Which task can be assigned to a registered nurse, RN, but not an LPN? A. Administering oral medications. B. Performing a complex wound dressing change. C. Monitoring a patient's vital signs. D. assisting with activities of daily living. Answer: B. Performing a complex wound dressing change. Question 11. A patient is receiving a blood transfusion and reports itching and a rash. What is the nurse's priority action? A. Slowing the transfusion rate. B. Stopping the transfusion immediately. C. Administering an antihistamine as prescribed. D. Monitoring the patient's vital signs. Answer: B. Stopping the transfusion immediately. Question 12. A nurse is prioritizing care for a patient with a new colostomy. Which action should the nurse perform first? A. Teaching the patient about colostomy care. B. Assessing the stoma for color and viability. C. Emptying the colostomy bag. D. Changing the colostomy appliance. Answer: B. Assessing the stoma for color and viability. Question 13. A nurse is delegating tasks to a UAP. Which task is inappropriate to delegate? A. Assisting a patient with hygiene care. B. Obtaining a urine sample from a catheter. C. Evaluating a patient's response to pain medication. D. Transporting a patient to radiology. Answer: C. Evaluating a patient's response to pain medication. Question 14. A patient with pneumonia is experiencing hypoxia. Which intervention should the nurse prioritize? A. Administering antibiotics as prescribed. B. Encouraging the patient to cough and deep breathe. C. Administering oxygen therapy as prescribed. D. Positioning the patient in a semi-Fowler's position. Answer: C. Administering oxygen therapy as prescribed. Question 15. A nurse is caring for a patient with a suspected stroke. Which assessment finding requires immediate action? A. Blood pressure of 140/90 mmHg. B. Sudden onset of unilateral weakness. C. Heart rate of 88 beats per minute. D. Respiratory rate of 16 breaths per minute. Answer: B. Sudden onset of unilateral weakness. Question 16. A nurse is assigning tasks to an LPN. Which task is within the LPN's scope of practice? A. Creating a discharge plan for a patient. B. Administering a prescribed enema. C. Performing a neurological assessment. D. Adjusting a patient's infusion rate. Answer: B. Administering a prescribed enema. Question 17. A patient with chronic obstructive pulmonary disease, COPD, is experiencing increased dyspnea. What is the nurse's priority action? A. Administering a rescue inhaler as prescribed. B. Teaching the patient pursed lip breathing. C. Encouraging the patient to increase fluid intake. D. Positioning the patient in a reclining position. Answer: A. Administering a rescue inhaler as prescribed. Question 18. A nurse is prioritizing care for 4 patients. Which patient should the nurse assess first? A. A patient with a blood glucose level of 180 milligrams per deciliter. B. A patient with a new onset of confusion. C. A patient with a urinary catheter reporting discomfort. D. A patient awaiting discharge instructions. Answer: B. A patient with a new onset of confusion. Question 19. A nurse is delegating tasks to a UAP. Which task is appropriate to delegate? A. Feeding a patient with no swallowing difficulties. B. Administering a topical medication. C. Assessing a patient's pain level. D. Changing a sterile dressing. Answer: A. Feeding a patient with no swallowing difficulties. Question 20. A patient with a history of seizures is experiencing a tonic-clonic seizure. What is the nurse's priority action? A. Administering an anticonvulsant medication orally. B. Placing a padded tongue blade in the patient's mouth. C. Ensuring the patient's airway is protected. D. Restraining the patient to prevent injury. Answer: C. Ensuring the patient's airway is protected. Question 21. A nurse is caring for a patient with a new tracheostomy. Which action should the nurse prioritize? A. Teaching the patient about tracheostomy care. B. Suctioning the tracheostomy as needed. C. Changing the tracheostomy dressing. D. Assessing the tracheostomy site for infection. Answer: B. Suctioning the tracheostomy as needed. Question 22. A nurse is delegating tasks to a licensed practical nurse, LPN. Which task is appropriate to delegate? A. Performing a sterile dressing change. B. Developing a patient's nutritional plan. C. Conducting a psychosocial assessment. D. Initiating a patient's four-line. Answer: A. Performing a sterile dressing change. Question 23. A patient with a head injury is showing signs of increased intracranial pressure. Which finding requires immediate intervention? A. Blood pressure of 130/80 mmHg. B. Dilated and non-reactive pupils. C. Heart rate of 80 beats per minute. D. Respiratory rate of 18 breaths per minute. Answer: B. Dilated and non-reactive pupils. Question 24. A nurse is prioritizing care for a patient with diabetic ketoacidosis. Which intervention should the nurse perform first? A. Administering insulin as prescribed. B. Teaching the patient about dietary changes. C. Monitoring the patient's urine output. D. Undo encouraging oral fluid intake. Answer: A. Administering insulin as prescribed. Question 25. A nurse is assigning tasks to unlicensed assistive personnel, UAP. Which task is appropriate to assign? A. Repositioning a patient every 2 hours. B. Administering a prescribed suppository. C. Evaluating a patient's response to therapy. D. Adjusting a patient's oxygen flow rate. Answer: A. Repositioning a patient every 2 hours. Question 26. A patient is postoperative following a cholecystectomy and reports nausea. What is the nurse's priority action? A. Administering an antiemetic as prescribed. B. Encouraging the patient to ambulate. C. Offering the patient a full liquid diet. D. Teaching the patient about incision care. Answer: A. Administering an antiemetic as prescribed. Question 27. A nurse is triaging patients in the emergency department. Which patient should be prioritized for immediate care? A. A patient with a migraine headache. B. A patient with a blood pressure of 220/110 mmHg and chest pain. C. A patient with a minor abrasion on the knee. D. A patient with a sore throat and fever. Answer: B. A patient with a blood pressure of 220/110 mmHg and chest pain. Question 28. A nurse is caring for a patient receiving heparin therapy. Which laboratory value should the nurse monitor closely? A. International Normalized Ratio, INR. B. Activated Partial Thromboplastin Time, APTT. C. Platelet count. D. Prothrombin time, PT. Answer: B. Activated Partial Thromboplastin Time, APTT. Question 29. A nurse is delegating tasks to a certified nursing assistant, CNA. Which task is inappropriate to delegate? A. Assisting a patient with oral hygiene. B. Obtaining a patient's weight. C. Administering a prescribed eye drop. D. Helping a patient with a bedpan. Answer: C. Administering a prescribed eye drop. Question 30. A patient with chronic kidney disease is experiencing hyperkalemia. Which finding requires immediate action? A. Serum potassium level of 5.8 milliequivalent/L. B. Muscle weakness and cardiac dysrhythmias. C. Decreased urine output. D. Blood pressure of 150/90 mmHg. Answer: B. Muscle weakness and cardiac dysrhythmias. Question 31. A nurse is prioritizing care for a patient with a burn injury. Which intervention should the nurse perform first? A. Administering pain medication as prescribed. B. Assessing the patient's airway and breathing. C. Calculating the total body surface area affected. D. Starting in 4-line for fluid resuscitation. Answer. B. Assessing the patient's airway and breathing. Question 32. A nurse is assigning tasks to an LPN. Which task is within the LPN's scope of practice? A. Administering prescribed oral antibiotics. B. Performing a patient's admission assessment. C. Developing a patient's discharge plan. D. Initiating a blood transfusion. Answer. A. Administering prescribed oral antibiotics. Question 33. A patient with a spinal cord injury is at risk for autonomic dysreflexia. Which symptom requires immediate intervention? A. Heart rate of 70 beats per minute. B. Severe headache and hypertension. C. Increased spasticity in the legs. D. Temperature of 99.0 degrees Fahrenheit, 37.2 degrees Celsius. Answer. B. Severe headache and hypertension. Question 34. A nurse is caring for a patient with a gastrointestinal bleed. Which finding requires immediate action? A. Hemoglobin level of 12 G/DL. B. Heart rate of 120 beats per minute and hypotension. C. Mild abdominal discomfort. D. Stool positive for occult blood. Answer. B. Heart rate of 120 beats per minute and hypotension. Question 35. A nurse is delegating tasks to a UAP. Which task is appropriate to delegate? A. Measuring and recording a patient's intake and output. B. Administering a prescribed inhalation treatment. C. Assessing a patient's skin integrity. D. Changing a patient's dressing. Answer. A. Measuring and recording a patient's intake and output. Question 36. A patient with asthma is experiencing an acute exacerbation. What is the nurse's priority action? A. Administering a bronchodilator as prescribed. B. Teaching the patient about trigger avoidance. C. Encouraging the patient to drink fluids. D. Positioning the patient in a supine position. Answer. A. Administering a bronchodilator as prescribed. Question 37. A nurse is prioritizing care for 4 patients. Which patient should the nurse assess first? A. A patient with a urinary tract infection and a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius. B. A patient with a new onset of atrial fibrillation and a heart rate of 140 beats per minute. C. A patient with a cast reporting mild discomfort. D. A patient awaiting a routine medication. Answer. B. A patient with a new onset of atrial fibrillation and a heart rate of 140 beats per minute. Question 38. A nurse is caring for a patient receiving chemotherapy. Which precaution should the nurse prioritize? A. Using standard precautions for all patient contact. B. Implementing neutropenic precautions. C. Encouraging the patient to ambulate frequently. D. Administering antiemetics only after nausea occurs. Answer. B. Implementing neutropenic precautions. Question 39. A nurse is assigning tasks to a CNA. Which task is appropriate to assign? A. Assisting a patient with range of motion exercises. B. Administering a prescribed topical ointment. C. Monitoring a patient's blood pressure. D. Evaluating a patient's mobility needs. Answer. A. Assisting a patient with range of motion exercises. Question 40. A patient with a history of heart failure is experiencing peripheral edema and weight gain. What is the nurse's priority action? A. Encouraging the patient to increase physical activity. B. Administering a diuretic as prescribed. C. Teaching the patient about a low-sodium diet. D. Monitoring the patient's daily weight. Answer: B. Administering a diuretic as prescribed. Question 41. A nurse is caring for a patient with a new onset of atrial fibrillation. Which intervention should the nurse prioritize? A. Administering a beta blocker as prescribed. B. Teaching the patient about anticoagulant therapy. C. Encouraging the patient to perform deep breathing exercises. D. Monitoring the patient's fluid intake. Answer: A. Administering a beta blocker as prescribed. Question 42. A nurse is delegating tasks to a licensed practical nurse, LPN. Which task is appropriate to delegate? A. Administering a prescribed intramuscular injection. B. Performing a comprehensive patient assessment. C. Developing a patient's care plan. D. Initiating a patient's discharge teaching. Answer: A. Administering a prescribed intramuscular injection. Question 43. A patient with a fractured femur is at risk for fat embolism syndrome. Which finding requires immediate action? A. Pain at the fracture site. B. Petechiae on the chest and altered mental status. C. Swelling around the fracture site. D. Temperature of 99.5 degrees Fahrenheit, 37.5 degrees Celsius. Answer: B. Petechiae on the chest and altered mental status. Question 44. A nurse is prioritizing care for a patient with sepsis. Which intervention should the nurse perform first? A. Administering antibiotics as prescribed. B. Obtaining blood cultures. C. Encouraging oral fluid intake. D. Teaching a patient about infection prevention. Answer: B. Obtaining blood cultures. Question 45. A nurse is assigning tasks to unlicensed assistive personnel, UAP. Which task is appropriate to assign? A. Assisting a patient with transferring to a chair. B. Administering a prescribed oral medication. C. Assessing a patient's pain level. D. Changing a patient's sterile dressing. Answer: A. Assisting a patient with transferring to a chair. Question 46. A patient with a history of cirrhosis is experiencing hepatic encephalopathy. Which finding requires immediate intervention? A. Mild jaundice. B. Hysterexis and confusion. C. Abdominal distension. D. Heart rate of 76 beats per minute. Answer: B. Hysterexis and confusion. Question 47. A nurse is caring for a patient with a central venous catheter. Which action should the nurse prioritize to prevent infection? A. Changing the catheter dressing every 24 hours. B. Using sterile technique during dressing changes. C. Flushing the catheter with saline every 12 hours. D. Encouraging the patient to clean the site daily. Answer: B. Using sterile technique during dressing changes. Question 48. A nurse is triaging patients in a clinic. Which patient should be prioritized for immediate assessment? A. A patient with a cough and low-grade fever. B. A patient reporting sudden vision loss in one eye. C. A patient with a rash on the arm. D. A patient with mild joint pain. Answer: B. A patient reporting sudden vision loss in one eye. Question 49. A nurse is delegating tasks to a certified nursing assistant, CNA. Which task is appropriate to delegate? A. Providing a patient with a bed bath. B. Administering a prescribed enema. C. Monitoring a patient's blood glucose. D. Evaluating a patient's response to therapy. Answer: A. Providing a patient with a bed bath. Question 50. A patient with a history of anaphylaxis is experiencing difficulty breathing after a bee sting. What is the nurse's priority action? A. Administering an antihistamine as prescribed. B. Administering epinephrine as prescribed. C. Encouraging the patient to rest. D. Monitoring the patient's vital signs. Answer: B. Administering epinephrine as prescribed. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.